Hi guys, in this video we are looking at some trunk muscles and also muscles that we have in the gluteal region. So let's start with our beautiful rectus abdominis. This is our six-pack, okay? Or the one we wish to have, right? Now this is rectus because it's straight down, and abdominis because it is in the abdomen. So very easy to remember, rectus abdominis muscle. And we can also see the rectus abdominis when we remove the anterior part of this model. We can see it right here. Now when we look in the posterior lateral aspect, can you see that we have this big chunk of muscle? And this big chunk of muscle is lateral and dorsal. Yes, that is the reason why this muscle was named Latissimus dorsi. Latissimus because it's lateral, dorsi because it's dorsal. So this is your famous Latissimus dorsi muscle. And this is the muscle that I told you that the teres major has the same function. Remember when we covered the teres major, I told you the teres major has the same function of a major muscle, and the major muscle is the Latissimus dorsi. And now you know how to identify it. Now when we look anteriorly and we remove this part of Philip, we can see this muscle right here, and this muscle is the one that's closer to the major blood vessels, and that's how you do to remember that this muscle is the psoas major. And you can also see the psoas major in this model right here. So the psoas major is the muscle that's close to the major blood vessels that you have right here. Also, another way you can do to remember is that the psoas major medial, the psoas major is the one that's close to the midline of the body. But the easy way is the major blood vessels. So this is the psoas major. Now we see here that we have the iliac crest. So this is the iliacus, and also you have here the iliac crest. So this has to be the iliacus. When the psoas major and the iliacus get together, they form the iliopsoas that we saw in the other lab. So here you would have the iliopsoas, the junction between the iliacus and the psoas major. Now, if you can identify the psoas major and the iliacus, and you have this little square right here, this little square is left to be the Quadratus lumborum, because in the lumbar region, and it looks like a little square, so it was named Quadratus lumborum. And you can also see the Quadratus lumborum in this model. So let me make sure. Here we go. Quadratus lumborum here, and obviously you can see it here as well. So these are the Quadratus lumborum in that model. When we look posteriorly right here, now we can see the gluteal region muscles. This is the gluteus maximus, all this, which is the big one, and then we have the gluteus medius right here. So this big chunk right here is the gluteus maximus, and when we look right here, so more lateral, we have the gluteus medius, and we cannot see the gluteus minimus, so we're just learning the gluteus maximus and the gluteus medius right here. Now underneath the gluteus medius we have this muscle right here that looks like a pizza slice, and that's how you do to remember that the pizza shaped muscle is the piriformis muscle. So this is P for pizza, piriformis. And now underneath the piriformis you have the superior gemellus, then you have the obturator internus, and all the way down you have the inferior gemellus. So piriformis or gluteus medius, piriformis, superior gemellus, obturator internus, and inferior gemellus. When we look right here in the lateral view, you can see this one, that's the tensor fasciae latae, which goes down, and then you have like the iliotibial tract, also called iliotibial band or IT band. And here you have going straight down in the anterior aspect of the femur. This is the rectus femoris muscle, which is one of the quadriceps femoris muscle. Also, you can see right here this muscle that goes from side to side. Which muscle do you believe this one is? This is the sartorius muscle. And lastly, in this model, we need to look at the most important skeletal muscle we have in our body, which is this one, that our lungs sit on top. This muscle is the diaphragm muscle. And the diaphragm, guys, you need to remember that when you look in this model, the diaphragm is not just the white part, that is the tendon. The diaphragm goes all the way down. So all these right here is also the diaphragm muscle.